Good morning.
Good morning.
So, Happy New Year.
Happy New Year to you as well.
So, great to see you. You are now maybe what, about 4 weeks?
Yeah, almost a month on the
Almost.
8th.
Yeah. We did a lower face neck lift only for you, correct?
Correct.
And we did this under IV sedation for you.
Yes.
So, you were sleeping and you didn't feel anything.
Correct.
This is a special interview for patients, I think, who are interested in learning because your background is in psychology.
Yes.
Correct? And so you obviously look absolutely fabulous. Your neck, jawline look fantastic. Your smile looks great. Your cheeks, everything about you looks fantastic. And I can tell from the smile that you're very happy and you're back at work and all.
Yes.
But I think, I would love to hear your journey, your experience, the good parts, the bad parts of the healing process and how you feel now that you're on the other side.
Sure. So I think I was naive and, I wanted it and I knew I wanted it. So I just said, I'm going to go for it. And that's what I did.
Why did you want it? What was the problem?
Mostly it was about my neck. I could see the neck like getting really wrinkly and crepey and getting old. And then when I would turn sideways, I would see this whole piece of skin kind of just being laxed over here. So that was, and then I had jowls as well. So yeah, everything was kind of falling down and I didn't feel the way I looked. I wanted to look how I felt and with my energy level and, that kind of stuff. So yeah, so I decided, okay, I'm doing this. And then I did my research and
where did you go to for your research?
I went YouTube.
Okay.
You were the only one, Dr. Kusuma, that had only the neck and lower. Like most of the other psychiatrists, most of the other specialists only had a whole. Like you have to do everything. And so I didn't want that. I just wanted the lower part of it. So, and then I looked at all your videos and I liked your demeanor, which is extremely important to me as a patient. And I saw your work and I said, yeah, this is it. That was it. So I came, I had the assessment and it was pretty quick. I think one of I believe it was Linda, she actually told me, go to other places, go to other doctors. And I said, well, I've looked at a lot of doctors, so I think I already chose it. And so when I came, I was just ready to go ahead and do it.
And you made a decision based on online research, basically?
Yes.
Okay.
Yes.
And tell us about your experience. How did everything go? And
yeah, so actually, I think it was Linda who said, well, you don't have to go to sleep. You won't feel anything. You could just do the regular, which is I forgot what it is, the name of just where you're awake.
IV sedation. So IV sedation basically means that you get medicine through the IV.
Right.
And you sleep, you don't remember, you don't feel, and you don't have any pain
right.
Or anxiety. The other way to do it is under straight local anesthesia where you're fully awake, but have some pills that you take. And we don't give any IV medicine. It's basically, numbing up the area with injections when you're a little bit drowsy with the pills.
Right.
And that's it. So that's a local anesthesia. And
yes.
the other one is called IV anesthesia where you get the IV medicine. And so you
okay.
get a lot more, deeper sleep.
Right.
But we don't ever put breathing tubes in your throat.
Right. Yes. So I didn't feel anything.
So to clarify, the other surgeon that you liked in Chicago was proposing the entire work for the face, everything else, and that was quite expensive.
Yes.
You wanted a limited operation just to address your neck and your jawline, and therefore I came about for that choice. So that you had a choice. You didn't have to do everything.
Right.
Okay.
Right. So right after the operation, and Dr. Kusuma has sent me videos of the actual of what he actually did, which was pretty amazing. I'm not squeamish about that stuff, so I was like, wow, okay. And yeah, and that whole thing made me think of, like, my husband said to me, he said, look, he saw it as well, and he said, what do you expect? Because what, of course, what happened afterwards, you're swollen, you're of course drowsy from the medication, but you don't feel much pain the first couple of days. But I feel I'm the type of person that is more I heal slowly, I believe, and also I'm a whiner. I don't like pain. So I kept calling Dr. Kusuma for pain medication. And at one point he was like, okay, you need to stop. So I said, okay, I'll stop. But so I started taking Motrin, and that was, even now I'm actually taking like twice a day. I take the combination of Motrin and acetaminophen. Um, because like I said, I can feel like I'm very sensitive, and so I can feel like everything that's happening in my face, and I needed to have that. I need to have that. So uh I think, like I said, it's almost a month now, and as you can see, I still have some swelling, bruising. There's a bruise under my eye here. I have a lot of stuff up in back of my ears, which I don't really care about because you can't see it, but it's a lot. And so during that month, I think it was probably the second week that I became depressed, and I didn't know that that was something that could happen. But I did, because the thing is you're in the house 24/7. You can't leave. And then I was thinking that I could work the next week. And I found that I had to tell my clients, if you want to talk by phone, we can do that, but I cannot do virtual. And
That's interesting because, I mean, this is what I do primarily, and there's patients with different experiences,
mhm,
and some patients don't need hardly any pain medicine.
mhm,
Some people recover psychologically much faster.
yeah,
Although they have pain, they're able to work through it, and
right,
they've gotten back to work in a week or less, some of them.
yeah.
Not everybody. So that's why getting a broad perspective of different experiences for patients is important.
Yes, because I mean, I've seen tons of videos of women that are like, oh, okay, so here it is, week 2. I have makeup on. I'm doing good, and they're healing a lot faster than I've healed.
So
And
let's also distinguish. You healed normally. It
mhm,
took you a little longer psychologically to get to going, because you
yes,
didn't have any issues from the surgical part of it. Like,
no,
you didn't have any complications issues at all, zero. So you
right,
healed normally like everybody else. What you mean, I believe, is that it took you mentally and emotionally, psychologically a little longer to feel back to normal, maybe.
right,
Is that
and
fair to say?
well, yes, but also the pain level, because
Yeah.
the pain for me is I guess I'm more um, sensitive to
Mhm,
it.
mhm.
So it's lasted longer.
Would you do it again, knowing what you know now?
Yes. And we were talking, previously in the other office, and I said to you, if I would have known everything like raw, like this is what's going to happen, although I understand that you can't, because every patient is different.
Yes.
But I guess if a patient would tell you, hey, I'm a baby with pain, I can feel my pain a lot more, than regular, then, maybe giving more information, I still would have done it, and I still would have, and I still feel wonderful about it. Um, but I don't know, maybe, I don't know if it would have made a difference psychologically. I believe it might have, for me personally,
Yeah.
not for anybody else, but for me. So, yeah, I think, to think about the information, because I'm also a person that likes information. Like, I like doctors will usually not not your type of doctors, but any doctor. They'll, I go to the doctor and they'll say, okay, well, this is happening, and it'll be very brief, and I'll say, no, I want more information.
Mm.
Like, what exactly is going on? Because I can go down the rabbit hole and I can understand. So, yeah. So for me personally, it would have been like, okay,
So, as opposed to the other doctor who may have offered everything at one time, which I also do when needed, when people want it.
yes.
But in your case, my recommendation to you is to consider your upper and lower lids at some point in the future, which I think is going to benefit you even more as you go along. And I would recommend you do some minor skin treatments that we offer that also help you with laser resurfacing, things like that, and microneedling that will also help you maintain a nice, healthy face.
Yeah.
So this is very helpful for patients. Thank you so much for sharing
You're
your
welcome.
perspective, especially coming from somebody with a psychology background. I think is helpful.
Yeah, and it's kind of like being pregnant, right? When you're pregnant, you're like, oh, the baby, and then you have the baby, and you go through all this pain, and then maybe 6 months to a year later, like you don't remember it, and you want more.
Yeah.
So, yeah.
Great.
So,
You look wonderful. Have a good day.
thank you.